Belle and I are at the CRE research retreat, and we're just reflecting on the fact that last week we were at the People's Health Assembly in Bangladesh, which was attended by about 1,200 people from about 70 odd countries around the world. And we were talking about health equity there, and we're talking about the impact of neoliberalism on health and all sorts of ideas. And I think, Belle, you went to mostly sessions on trade and health, didn't you?
Yeah.
What sort of key messages came out of that?
So we had a panel on trade and health. We brought together delegates from the European region, Southeast Asia and the Pacific and Africa, and we really discussed the different ways that trade can impact on health. So access to medicines is one issue, but also access to health services, investors being able to sue governments over their public health regulations. And then we had a series of strategy meetings over the following days to really work out what it is that the People's Health Movement is going to do to put public health front and centre above private interests in trade.
Yeah, that was great. It sounded like there was a lot of strategizing going on as well as analysis, which is fantastic. Yeah, because I went along to the health sector ones, and there we were talking a lot about primary health care and how primary health care should be the basis of health systems. But what we also realised was every country around the world had stories of how health sectors were being privatised, whether it was outsourcing laboratory services or using contract workers or running down public sectors or bringing in private health insurance under the cover of universal health coverage. We got very concerned about privatisation, and this coming year in 2019 the People's Health Movement is planning some concerted days of action against the privatisation of health services. And I think that kind of relates a bit to the trade too, doesn't it? Because sometimes some of these big multinational companies can challenge governments on the basis of free trade agreements and say we have to have access to your healthcare market. So there were lots of overlaps, and it was a bit frustrating really. You had to choose one stream to go to. So I missed out on the trade discussions, but it was very exciting.
Why is privatisation a health issue?
Well, I think when you get a privatised health system, I think if you think about the US, they're spending something like 15% of their GDP on health. They've got a highly privatised system, and yet they've also got millions, about 40 million people who don't have access to insurance, especially since Obamacare has been wound back. Whereas in systems like in Australia, where we do at least have a publicly funded health insurance scheme, Medicare, it means that the public services mean everybody has a right of access to healthcare. Everybody goes to hospital and it doesn't cost them anything. So, you know, that's the difference. And the more we privatise, we're basically creating profits for shareholders and not just looking at what health the people need.
So we're in quite a volatile political environment in Australia at the moment with the landslide Victorian election. I don't know if you've just seen, but there's big changes in the federal parliament just happening. We've got an election coming up there, also the New South Wales election. So, you know, what's your message to the community as we come up to further elections arising from the meeting you've just been at?
Well, I mean, I think it comes down to the fact that we have to think about that our health is about the health systems, but it's also about social determinants of health. So in Australia now, we've basically got a housing crisis, I think we could say, you know, especially if you're in Sydney, housing's become unaffordable. Employment conditions are being wound back, and we've been hearing at our research retreat how that affects people's health when they're employed casually, when they're living on welfare, on New Start, which is only about $270 a week. It's not really enough to live on in a healthy way. So there's all sorts of ways in which those basic living conditions are really affecting our health, I think. And yeah, I think you'd point to trade agreements as well, wouldn't you, Belle, that Australia's facing?
Yep, Australia's negotiating the Regional Comprehensive Economic Partnership Agreement at the moment, and there are a number of issues in this trade agreement that we're concerned about for the health of not only Australians but people living in the Southeast Asian countries who are negotiating with Australia. So our message would be for the trade negotiators to really put protecting public health front and centre in the negotiations.
And coming back to the People's Health Assembly, what was your favourite moment, Belle?
I think in the mornings, every morning a different group would do a march towards the building that we were hosting, and they would be chanting and with their banners, and so there was this sort of momentum in the air, and people were having conversations with each other about the struggles that they were experiencing. So it was sort of everybody had a shared vision, and I think that was a really great, inspiring to keep going in Australia, to meet people who have been struggling much more than we have in other countries.
Brilliant, thank you. What was your favourite moment?
Oh, I think mine has to be at the end. Every region came up and sang a song, and the Italians sang Ciao Bella, and it was just so beautiful hearing, well, it wasn't just led by the Italians, the European region, and what was so heartening for me, I must be getting old, is all the young people that were involved, you know, people definitely under 40, many under 30, and the huge enthusiasm, and everyone was shouting, "Health for all now!" And we're all, and it was just a real feeling of solidarity, and it was very exciting.
Brilliant, thank you. Well, we look forward to having a post at Croaky soon.
Yeah, great.